Hey guys, my name is Evan Ernst. I'm with the nonprofit Who We Play For. Before we share our story, we just want to thank you guys, Dave, El Presidente, and the entire Barstool family. What you guys are doing right now for America's small businesses and small nonprofits is incredible. If there's one thing we've learned in the last couple of years, it's don't count on the government. So thank you guys for filling the gap as entrepreneurs and leaders in the community. Our story starts in a tiny town in Cocoa Beach, Florida. We all grew up obsessed with soccer from kindergarten on with the same group of kids. These group of kids later went off to Florida State University. We're in room 114 of our fraternity house. We came together and we founded a nonprofit called Who We Play For. The vision and the dream was to create a national movement to advance the standard of care, to provide every single kid the opportunity to have their heart checked. So you see, for us growing up, just a few years before we created Who We Play For, and a few years before we sat in room 114, we had all watched our lifelong teammate, our childhood best friend, collapse and die on the soccer field from a detectable heart condition, missing his sports physical. When we got to college, we realized what our teammate Rafe represented, and that's the leading cause of death in all of schools, in all of sports, in all of kids, in all of student athletes. And we were disgusted and we were furious that in other countries, this is a standard of care, heart screenings. Every kid gets it before they play sports. But in America, it's just a recommendation of the fine print. And the results every single year are thousands of deaths that can be prevented, and a generation of kids who never got to grow up, just like our teammate Rafe. So what does Who We Play For do now? As a nonprofit, we created the systems and the program to provide affordable heart screenings at just $20 for student athletes across the country, and a few others in some occasions. Through telehealth, we've been able to partner with the leading experts in the world on this issue, including Dr. P in Italy, who created a policy in 1982 that required these heart screenings for every student athlete. The result of that policy was a 90% reduction in sudden cardiac death in student athletes. Since 1982 in America, we've reduced sudden cardiac arrest by 0%. We've invested billions of dollars into AEDs, which shock you back to life, to CPR, and to emergency action plans. All great things, all things that need more funding. But when the problem is this big and we're constantly treating the symptom, sudden cardiac arrest, and not the root, the underlying heart condition, it's insanity. So what have we been able to do in the community these last couple of years, 7 or 8 years of hammering away with the same group of best friends? We've been able to create the largest organization of its kind in the world. We've screened 500 plus athletic programs, from professional to D1, D2, D3, NAIA, HBCU, to the most vulnerable middle school athletic programs in America. A few months ago, we presented to every single pediatric doctor in all of America at the American Academy of Pediatrics National Conference, just a few hours after Dr. Fauci, which is insane. And the presentation was with UCF's medical school, and it marked the first time in the history of our beautiful country that heart screenings have been required. And it was right here in our home county, Brevard County, one of the biggest school districts in Florida. And in our mind, that presentation in just 8 minutes on the data that we collected after 1 year of work in one policy to require heart screenings was the mic drop to prove that this is not only feasible, but it should be a standard of care for every kid. So our hope with you right now, to Dave and to the Barstool Fund, is that right now we're in an existential crisis as an organization. The need has never been higher for what we do. COVID-19 has attacked America's athletes and America's youth heart by increasing the prevalence of a condition called myocarditis. And the opportunity to have your heart screened with an ECG, whether you're a D1, a D2, a JUCO, a whatever middle school athlete, has never been more difficult because the school's budgets have never been more strapped. If you're a big time D1 athlete, you're probably gonna be all right. But if you're going to an NAIA school where they're just trying to figure out how to keep the lights on, taking on another service is pretty difficult to do when you're not even sure if you can have sports. So how has the pandemic hurt us? We provide a service pre-pandemic that involved us showing up on site at schools across the country. Obviously, it's pretty hard to do that when schools are shut down and when you can't come on site. So in the last however many months, 8-9 months of pandemic, we've lost hundreds of thousands of dollars from the affordable service we provide, and there's been tens of thousands of kids who would have had their heart screened, who would have been identified with life-threatening heart conditions, but were never given that opportunity. In the last couple months, we've been able to create and pivot our program to a self-service shipping model. So we've been sending this to schools, training them, getting them geared up. And in the example of a great school that I'm sure you haven't heard of, University of Pikesville, God bless them. They started their screening program, we shipped them the equipment, trained them remotely, and after screening just 50 student athletes, their program had 3 kids who had surgery to save their life. And that was possible because we fundraised, we supported them, and we helped make it happen. So our organization so far, Dave, we screened 150,000 student athletes across the country, and we've saved over 150 lives. Just like this young man right here, Xavier Hendricks. Passed every sports physical he ever had his heart screened, had surgery, a few surgeries, and was able to make it back and play. So how do we plan to use this funding, Dave and the Barstool family? What we propose doing, if we're so lucky to get to $20,000, is we'll partner with the most vulnerable colleges in America to continue to outfit them and help pay for the $20 service per athlete that they otherwise cannot afford until they're able to write the budget, which could be, possibly years in the future. And we'll be able to further employ our team to deliver that service. So if you give us $20,000, divide that by 20, we can screen 1,000 kids. How many athletes at most of these schools? Around 250 to 300. So we'll be able to immediately deploy this program to 4 or 5 schools across the United States and screen their entire athletic program. And what does that mean when it comes down to it? Well, 1 in 300 kids have a life-threatening heart condition, Dave. They had no clue. And this heart screening, 1 out of 300. The law of large numbers, hand on my heart, I guarantee you when it's done, $20,000 later, we'll have a handful of kids who will get to live because the Barstool Fund enabled them and made that possible. So in closing, to El Presidente, to the Barstool Fund, I say this in this awkward video, hard to do, but absolutely worth it. We worked on this organization and this vision our entire lives, adult lives, from teenagers to finishing out our 20s. Those same years, we grew up on Barstool Sports, and we're reaching out to you, we're asking for help and joining us in this mission. We brought together the world's leaders in medicine and more people who've been affected, and we've locked arms with folks around the country like Coach Bobby Ballard, FSU and the United States' greatest coach of all time, and people like Russell Westbrook of the Washington Wizards, who at 15 watched his teammate die the same way we did. So we have all these people, we've locked arms, but we're struggling and we need help. And to overcome this existential crisis, we're asking for y'all to step in and join us. And the end result, when it's all said and done, if we can make it over this hump with the partners and the people that we have in place, will be a standard of care that's advanced in the United States. And a generation of kids, thousands of kids, AAU athletes, college athletes, high school kids, who will get to grow up and raise family and not be buried in their team or buried on their field like our teammate is, and they won't need to be carried by their community and carried by their teammate down their church aisle still wearing their jersey and their boots. It's insane that this is such a big problem in America when it's so preventable, and we want to keep working on it, and we will. We will finish the job. But Barstool Fund, I hope you'll consider us for this monthly commitment to help us together finish the job. Thank you.